Hello, everyone. My name is Terrell Parker, pronouns he and L with NMAC. I am the manager with Escalate, ending stigma through collaboration and lifting all to empowerment. I'd like to thank you all for joining us for today's webinar, How to Escalate Your Community-Based Organization. I'm really excited to have two of my colleagues, Elise and Chandria, with us today. Elise is here to share more information about our TA program with Apple Associates, and Chandria is here to share more about our learning collaboratives with NORC at the University of Chicago. So with that stated, let's go ahead and get started. Next slide. Of course, I'd like to start with introducing our NMAC team who makes all of this work possible. Our director, Charles Shazer Jr., myself, Cora Treyes Cartagenas, Christopher Paisano, Durnell Green, and Marshawn Redmond, our fabulous Escalate team. And of course, we'd like to thank our funders who make this work possible. This work could not be possible without the work of our funders and our supporters. Next slide. So what is Escalate and what does it mean to escalate your community-based organization? Escalate stands for Ending Stigma Through Collaboration and Lifting All to Empowerment. Escalate trains and builds the capacity of participants to recognize and address stigma within the Ryan White HIV/AIDS program. So in your case, our goal is to help train you that you can recognize so that you can understand what HIV-related stigma looks like, and then go beyond just recognizing it, but being able to address it through tools, resources, and support. We hope that if you participate in Escalate, you have the opportunity to recognize and address what HIV-related stigma looks like within your community-based organization. It's also important to discuss that Escalate reflects the mission of NMAC. If you know our mission statement is that NMAC leads with race to urgently fight for health equity and racial justice in the United States. So what does that mean? That means that Escalate reflects our mission and our relationship to communities of people living with HIV. Specifically, NMAC leads with race because we know that the burden of the HIV epidemic today deeply impacts and is felt by racial and ethnic minority communities. So we believe at NMAC that we cannot end the HIV epidemic in the United States by 2030 if we don't get serious about ending HIV-related stigma. And we hope Escalate is the beginning of what that looks like. Next slide. So once again, the purpose of Escalate is to reduce stigma. But I think what's important to highlight here is that the goal is to reduce stigma on multiple levels. We want to reduce stigma on the individual client level. So what is that internalized stigma that people feel that they experience navigating the world as a person living with HIV? We also want to talk about what types of stigma occurs within organizations. And lastly, what can we do at a systemic level in our health departments, whether that's at our state health departments, city health departments, or county health departments? What can we do to systemically reduce HIV-related stigma in the work that we do? And lastly, we know the importance of cultural humility and humble care. We know that individuals living with HIV are more successful, they're more likely to be sustainably engaged in care, and they're more likely to reach viral suppression if they receive culturally humble care and services. So that's another core tenet of Escalate, is that we want to ensure that cultural humility and treatment and care settings for people living with HIV exists within the Ryan White HIV/AIDS program. Next slide. So next we'll talk about who will Escalate specifically engage. And Escalate, as we mentioned, reflects the mission statement of NMAC. So while we do work to end all types of HIV-related stigma, we found it important to focus on the communities that experience stigma the most. So Escalate has a heavy focus on reducing stigma in transgender and gender nonconforming individuals among men who have sex with men, Black and African American communities, Latinx communities, and American Indian Alaska Native communities. What's important to highlight here is that at the beginning of the process, at the very inception of Escalate, we thought it was important to bring these communities to the table, which is why we brought together a group of over 50 subject matter experts from these communities to help inform not only our Escalate model, but also the Escalate curriculum, because we wanted to be sure that we made a dent and an effort in reducing stigma in these communities. Next slide. And as I mentioned earlier, Escalate is for you. So who is our focus audience for Escalate? Escalate is meant to engage both Ryan White recipients and sub-recipients, as well as community members. And I'm not sure if we have our slide on the next slide or not, but Escalate is available for all Ryan White recipients and sub-recipients funded through parts A, B, C, and D. That includes health departments, federally qualified health centers, you all that are here with us today, community-based organizations, planning councils, and planning bodies as well. But the unique thing about Escalate is that Escalate creates a partnership with community and our Ryan White providers. Each team is required to have at least one person living with HIV represented on their Escalate team. And that's the partnership that we're talking about, because we believe if we're going to reduce stigma, it must be a partnership between agencies and communities. Next slide. And I don't know, is our slideshow maybe frozen? My slideshow hasn't moved. I don't know, how about you? Your slideshow moving, or are we stuck? All right, well, that's okay. We'll give it a second to see if our slideshow could possibly catch up. All right, so excuse me, I think we're having maybe some technical glitches, but we're just going to roll right through our technical glitches. So on my next slide is how do we eliminate HIV-related stigma in your community-based organization? So to answer that question, I think it's first important for us to go back really to the root. How can CBOs lead our efforts to end stigma? And I think that's the important word that I want to highlight. How can CBOs lead our efforts to end stigma? I think it's important to highlight that community-based organizations have an important role in combating HIV stigma. Oftentimes, community-based organizations are started by impacted communities. Oftentimes, community-based organizations are started by impacted communities as a direct response to stigma. Community-based organizations often employ members from communities that they serve, which means that they're often in the closest proximity to stigma that the community most likely experience. And we believe that that offers a unique perspective. So that offers organizations, community-based organizations, the opportunity to resist and reduce stigma. Meaning if you're closest to it, if you're more likely to see it. Sometimes individuals who work within community-based organizations often experience stigma by association themselves. So as you have the closest proximity to stigma, that often positions you to be the first to resist and reduce stigma. So that's why we believe it's an important role for community-based organizations to have as a leader in our efforts to reduce stigma. So next, I want to talk about our Escalate model, which is the reason why we have two of our fabulous partners here with us today. The Escalate program includes 3 specific tracks that support individuals and organizations in helping them to eliminate stigma. So the 3 tracks for Escalate that organizations can participate in are organizational training, which is led by NMAC, targeted time-limited technical assistance, which is led by Athens Associates, and also our learning collaboratives. Each track is specifically designed to engage organizations at various stages of their stigma reduction efforts. So for organizations that maybe are new to this work, organizations that would like for their staff to gain a common knowledge and understanding of HIV stigma, then training is perfect for you. Training provides an opportunity for your staff to learn stigma reduction language, tools, and resources. For organizations that may be more interested in taking a direct look at stigma and creating goals for reducing and eliminating stigma within their organization, then perhaps TA is a great option for you. And for organizations that have been doing this work for a while, organizations that are implementing stigma interventions and want the opportunity to learn in an environment with other organizations that are doing the work, then the learning collaboratives are a great fit for you. So we have our partners here today to share more information regarding each opportunity for you all to engage. So first, I'll talk really briefly about specifics for our Escalate training before I turn it over to Elise to share more information about technical assistance. Some of the benefits of training, as I mentioned earlier, is that the Escalate training establishes a common foundation and framework for eliminating stigma. Everyone at your organization who completes the Escalate training will walk away with this common understanding. They will walk away with the action plan and goals that they identify for specifically how they want to take the work back and reduce stigma within their environment. Participants learn how to facilitate transformational and relational changes in their community-based organization. So not only do we want to empower people with the knowledge, but we want people to walk away with tangible skills for how to facilitate transformation. How do we go beyond conversation to create real changes in our organizations? Beyond just learning how to facilitate changes within their organizations, participants will also have the opportunity to learn how to facilitate change within their community as well. We also focus on deepening awareness and practices of cultural humility because, as we said, we know that people living with HIV have better health outcomes when they receive cultural humble care. And lastly, we hope the participants will learn how to address their own internalized stigma, whether that be people living with HIV and the internalized stigma that they feel, or even people who work within the HIV workforce who feel internalized stigma by association. So we do have a few upcoming training opportunities for organizations that are interested. There are multiple ways to engage with our Escalate training. If you've seen some of our recent newsletters at NMAC, or maybe you visited our Target HIV website, then you will see a posting for several upcoming trainings. You'll see an upcoming training in Los Angeles, upcoming training in New Orleans, and also Miami. Unfortunately, all of our trainings are currently full, except Miami. In Miami, Florida, August 15th through the 19th, we will actually be launching our Escalate in Espanol program, which is Escalate specifically for Spanish speakers. We will also be having a cohort for English speakers as well. So there's an opportunity to participate in Escalate, whether English or Spanish is your preferred language. If you're interested in attending one of our national trainings, all you need to do is sign up on Target HIV. We ask that you send a group of 3 to 6 members from your organization to represent you in the training with one community member living with HIV. There are also opportunities for us to train your entire organization or even your entire community. If you're interested in scheduling a training, you can also visit us at targethiv.org/escalate. Our contact information is listed, and we can schedule training for your entire organization or even for your entire community. We also have an option to schedule a hybrid training where we merge in-person and our virtual trainings. And lastly, next month in June, we will be launching our learning management system where you can access our Escalate curriculum on demand. And this will be a great tool for continuous professional development and onboarding for new employees. So without further ado, I would like to turn it over to my colleague, Elise, to tell us more about Escalate Technical Assistance.
All right, thank you, Terrell. My name is Elise. My pronouns are she, her, and I work at Apt Associates, and I am one of the coaches for Escalate's Technical Assistance Program. So I'm going to tell you a little bit about what we do, and then I'll talk specifically about how community-based organizations might use our technical assistance services as part of this program. And before I begin, just a plug for the training. We did have a TA site go to the Dallas training last week and said it was absolutely incredible, a must attend if possible. Just had all the positive feedback in the world. So, so sign up for the training if you can, because it's really wonderful. Next slide, please. So, might be a little frozen again on my end, but so I work on a team of 5 people, and one of those people is a project director, and then my 3 colleagues and I are technical assistance coaches. And really the goals of technical assistance, we hope to help organizations, really work with organizations to increase the capacity and readiness of their organizations to address HIV-related stigma, particularly at a systems level, to support access and retention in care and services. Our approach is time limited. It's extremely tailored to what the organization needs. And we are very, as TA coaches, we're very explicit that we are not experts. The experts are you all in your organizations. And then we also work with subject matter experts in the field. So we have a pool of about 8 subject matter experts who have been working for years and years and years in the field. And that is also part of our technical assistance approach. The format of TA, like I said, so each site is assigned a TA coach, and that's myself and 3 of my colleagues. And we work with the site on an ongoing basis for 6 to 8 months. It depends on our timeline. This year was 6 months. And what the organization gets is 1 hour each month of a coaching call, and then separately 1 hour each month to meet with a subject matter expert. So we as coaches really help move the TA process along. We help the organization create a work plan and identify goals, identify timelines, identify responsible people, identify activities they want to work on. We match sites with subject matter experts who have expertise in those specific topics. And then we kind of watch the process unfold, help keep the site accountable to meeting goals. We're very flexible. We know that sites, especially community-based organizations, there's sometimes limitations to what can be done for a number of reasons, which we'll talk about in a little bit. But we really are kind of the coaches that coach you along through the technical assistance program. The other thing that we provide is ad hoc office hours. These are optional, but we have our subject matter experts kind of identify topics across different organizations. So for example, we've had office hours that are offered once a month on strategies to review policies and procedures through an equity lens, creating safe spaces for individuals who use drugs, the power of language, stigma directed towards individuals who are homeless. And we'll kind of look at what the organizations are working on in their individual sites, and we'll say, all right, it looks like 3 or 4 sites are working on how can we redo our policies and procedures to be less stigmatizing. So we're going to have an office hours with experts on that topic to walk folks through. Oh, great. It looks like the slides have caught up. Next slide, please. Okay, we can actually skip this slide for now just because for time's sake, I want to be respectful of time. But yeah, okay. Okay, that's the TA format. So let's talk a little bit about the TA sites that we currently have. So we actually have a fairly nice division between state, county, city health departments, federally qualified health centers, and what we would call community-based organizations. So as you can see, we work with 4 community-based organizations right now. That's the Eastern Oregon Center for Independent Living, Alliance, which is in Oregon, Alliance for Living, which is in Connecticut, Step Up, which is, and I always get confused between Step Up and Diverse and Resilient, so I apologize. I believe Step Up is in Indianapolis and Diverse and Resilient is in Milwaukee, Wisconsin. So as you can see, we work with sites all over the country. Next slide, please. So just to kind of paint the picture of where we're conducting TA, as you can see, we have, like I said, sites all over the country. And I'm just going to give you a kind of brief overview of the activities that some of our TA sites are working on, because this might give you an idea of goals within your own organization that you might be interested in working on. So for example, you can see that a lot of our sites were really interested in looking at their policies and procedures, whether that's client intake forms, medical record keeping, policies and procedures about, for example, restroom use, and really trying to undo any stigma that might have been present in language. This can include new hire orientation, stuff like that. So we had a lot of our sites really sit down with, literally one site sat down with their welcome manual for new staff and went through and looked at every word and identified stigmatizing language and recreated their policies and procedure manual that is free of stigmatizing language. A few sites were really interested in doing an internal organizational assessment. So this is one way that we can measure stigma that's present within an organization and what resources might exist within that organization to already combat stigma. One of the biggest things that we as TA coaches like to focus on is what efforts are already being done. We don't want to reinvent the wheel if we don't have to, because we know some of the limited capacity that a lot of these sites already have. They're really, really busy, understandably. So what's already within the organization that's available to build off of? And that's what an organizational assessment can help with. We have a few sites that want to make promotional materials about stigma reduction, and some sites that want to take their existing promotional materials and make sure that they are not further stigmatizing. We encouraged a lot of our sites to attend the anti-stigma training. A lot of them did attend the Escalate training, which was amazing, and others actually made their own training and are hoping to disseminate it throughout their site. We had a few sites interested in evaluation, hiring practices, creating toolkits, and one of my sites, New York City Department of Health, is actually developing an entire anti-stigma framework, and that's going to be kind of their calling card as they go to leadership to try to get them on board with really creating a culture within the Bureau of Anti-Stigma. So this is just an example of these activities, but I will say that the activities that you ultimately choose to do are up to you. We as TA coaches can help you narrow down, help you identify what might already be in progress in your organization, but there's a wide variety of things that you can do, and they're going to come from what you need. Next slide, please. We can actually skip this for time, yeah, but, and we can also skip this. Oh, sorry, we can actually go back to that really quickly. What's next? Yep, we're good. Okay, sorry. I'm sorry, our slide person. I did just want to quickly talk about what comes after TA, and that's where Chandra from NORC is going to talk to you about the Learning Collaborative. But one of the things that I just wanted to touch on briefly here is the difference between some of our sites that are not community-based organizations and some of our sites that are. So very quickly, as you saw, we do work with a lot of city, state, and county health departments. And I would say one of the most difficult things that they are facing as organizations at this point is there's a lot of bureaucracy and there's a lot of red tape. Now, that's not to assume that CBOs don't have their own kind of bureaucracy, but I will say that we're noticing that within the community-based organizations that we are working with, there is a lot less regulation that kind of stands in the way of some of these activities that that the organizations want to do. So in that regard, amazing. Community-based organizations we are seeing often have a little bit more flexibility. The challenges that we're seeing in some of the community-based organizations is sometimes funding can be more limited, not always, but we know that that can be a challenge when you're trying to tackle a bunch of different things at once and you're trying to find ways to incorporate anti-stigma activities. Funding can certainly be a challenge. And then the other thing is staffing. We also know that this can be an issue at state health departments, but often staff are stretched really thin and there might not be a whole lot of staff that are able to kind of add further activities into their everyday workflow, which is one of the reasons why as TA coaches, we really encourage organizations to look at what's already happening. In general, I would absolutely encourage you as a community-based organization to seek TA. We love working with CBOs. Like Terrell said, oftentimes CBOs are built in response to a community need. So oftentimes you might be already kind of further along in your understanding of how to implement some of these activities. And we love that and we support that. And yeah, just really honored to get to talk today. If you have any questions about the Escalate TA portion, feel free to ask at the end, or you can email Terrell. But yeah, that's the Escalate TA portion. And I will turn it over or back to you, Terrell.
Great. Do you want me to jump in here, Terrell, or? Okay, great. Hi, my name is Chandria Jones, and my pronouns are she, her, and hers. And I'm going to be talking to you about the Learning Collaborative. So next slide. So the Learning Collaborative team consists of myself and 4 or 5 others. I serve as a Learning Collaborative liaison, and we have 2 other liaisons as well as our project manager, project coordinator, and senior advisor. And so for any of you who may be a little bit unfamiliar with what a Learning Collaborative is, a Learning Collaborative is really a way to bring together organizations to really study and apply and improve on methods. So you've already heard, about the training opportunities and the technical assistance opportunities. And so those organizations that are really ready to engage in this work and move forward through peer learning, Learning Collaboratives are a great way to do that. So the Escalate Learning Collaboratives occur over a 12-month period. And during that time period, we have different learning sessions that are led by subject matter experts that are really engaging on a variety of different topics around how to identify your population of focus, how to strategize about stigma reduction activities, how to implement and evaluate those activities. Each one of our different action periods, we're covering one of those different topics. And so we're creating a process through co-learning and knowledge sharing where members of the Learning Collaboratives are really able to learn from each other to address their gaps in their practices and really apply firsthand information regarding stigma reduction. Next slide. All right, so the Escalate Learning Collaborative really focuses specifically on supporting Ryan White recipients and subrecipients in the development, planning, implementation, and evaluation and refinement portions of an initiative to really reduce the impact of HIV stigma. And so we do this through a lot of different strategies. So things from coaching, peer-to-peer learning, collaborative tracking, and then supporting stigma reduction through subject matter experts. And so we have right now we currently have 6 participants in the Learning Collaborative, and they are grouped together in affinity groups. Next slide. So participating in learning collaboratives can be beneficial for many different ways because we are supporting the actual implementation of stigma reduction activities and really tailoring content and engagement around where the different organizations are in planning their stigma reduction activities. So this is done through assessing stigma reduction needs, really helping people to think through who their population of focus is going to be, using data to actually drive decisions around identifying those populations of focus and coming up with stigma reduction strategies and activities and initiatives that are really tailored to the needs of their population of focus, and then assisting them with thinking now about how they're going to actually evaluate and refine those activities for improvement and expansion. Next slide. So we do have a particular structure that we're seeing works really well for teams that are wanting to participate in the learning collaborative. And so each team is asked to identify a stigma reduction change agent. And essentially that's going to be someone who is in a position of leadership in the organization who will actually be able to ensure that the strategies that are coming up have a way of actually being implemented in the organization. And that stigma reduction change agent essentially identifies 3 to 5 other people in the organization, and these people come together to form the stigma reduction team. And those are the ones that are actively involved in the learning collaborative. And of course, you know, being consistent with the kind of premise of Escalate, it is required that at least one individual represent members of the population of focus, and that it's also recommended that we have client-facing staff as part of the stigma reduction team. So whether that be frontline staff, patient educators, navigators, or providers. Next slide. So currently our learning collaborative is being convened over a 14-month period during which, you know, the stigma reduction team members usually spend anywhere from 6 to 10 hours per month working together on their stigma reduction strategies and initiatives. And through that, you know, we have monthly kind of large learning collaborative meetings, and then there are learning collaborative liaison check-ins as well as affinity group meetings. And so the affinity group meetings, we actually have 3 different affinity groups kind of where we really engage in that peer-to-peer learning. And so our affinity groups, we have one for community-based organizations, we have one for health systems, and we have another one for health departments. And so during that time, our stigma reduction teams are really able to learn from each other and really provide insights in co-learning and co-creating. Next slide. So our next slide, okay, there you go. We will be recruiting for the next cohort of learning collaborative members, and that application period will open sometime during this summer or fall. And of course, if you feel like your organization may not be ready to fully engage in a learning collaborative, we've already heard about great ways to participate in the Escalate training as well as the Escalate technical assistance. And next slide. And if you have any questions, you can get in touch with the Learning Collaborative by emailing escalate@norc.org. And I'll turn it back over to you, Terrell.
Okay, there we go. For some reason, I was having a difficult problem. 3 years into the pandemic, and I'm still having microphone issues, right? Maybe you'll just never get used to it. But before we transition into our question and answer, I wanted to just make sure we highlight one, that Escalate is totally free. It's free to participate in the trainings, even the trainings that are our national trainings. We do cover the cost for participants to participate, which includes travel, lodging. TA and Learning Collaborative is a totally free opportunity to engage in as well. So just want to make sure that we highlight that. And lastly, before we go to our question and answer session, I wanted to give John just a few minutes to talk about our Escalate organizational self-assessment and how community-based organizations can use this as a tool to learn how to reduce stigma. So John?
Okay, hi there. Thank you, Terrell, and everybody. Welcome to this webinar on Escalate. I know you were welcome before, but welcome from me too. And one of the things that we're doing in Escalate, my team is the evaluation team. Okay, so on all the activities you'll hear about, our team is responsible for collecting data and helping everybody understand how the project is progressing, what we're achieving, what people are learning, and so forth. One of the things that that we have done for the Escalate project is to create something called the Escalate Organizational Self-Assessment. It's called EOSA. Those are the letters, right? Escalate Organizational Self-Assessment. This is it's a survey tool that an individual can answer if you're working in a community organization that asks you questions about the status or existence or completeness of policies that you might have regarding HIV stigma and preventing or eliminating, mitigating the impact of stigma in your organization. On practices that you might have, so some things are not actually formal policies, but it may be your organization's practice that you do one thing or another. It will ask you about the support for the staff regarding stigma, and not just HIV stigma, but other forms of stigma, whether it's homophobia, transphobia, racism, religious discrimination, ageism, and so forth. Because these stigmas kind of come together in sort of intersectional and combined ways for some people, and a lot of the people in Ryan White programs who are persons living with HIV, have the impact of several of these. So we ask about training, what kind of training or other supports for you as a staff member. Then there's a set of questions about how the organization both reflects or represents the community that is its clientele, and whether or not they have some kind of capacity to participate with, collaborate, or become involved in how the agency makes decisions and policies. And the fourth section is a very quick assessment with, I think, 5 questions on your assessment of the organization's readiness for change. The EOSA is something we're using in Escalate. It's a part of the training that people are using to formulate lists of action steps to do as part of their training. And we are building it in Escalate to be a tool that organizations can use to assess themselves and make plans. And we're helping to train organizations on doing that in the process. So it's a tool that we're building into it and that we hope will come out of Escalate refined and able to help organizations that way. And so that's the Escalate organizational self-assessment. If you participate in Escalate, you'll learn a whole lot more about it, and we will talk at length. Okay.
Thank you, John. I just want to say that is a really amazing tool, and it's a tool that we use across the project. So regardless of what point of entry organizations begin Escalate, they will have an opportunity to complete that assessment. And really, it's been profound to be in the training space and to see organizations complete the EOSA and really how it drives the work that they do as they go back into their communities and into their organizations. So I think it's going to be a powerful tool that lives well beyond the Escalate project. Absolutely.
That
So
is
now, thank you, John. So now we'll open it up for questions and answers. If anyone has any questions for any of our panelists, whether that is for our technical assistants, learning collaboratives, or you'd like to learn more about our evaluation process. And Darnell, if you could help us out by reading any comments that are in our chat box for us.
All right, so the first question we have, will the PowerPoint for this presentation be shared?
Yes, this will be shared, as well as the recording as well.
What is the link to sign up for Escalate?
We'll drop it in the chat box, but it is targethiv.org/escalate.
How many people from my staff can attend an Escalate training?
It depends. If you're interested in sending someone to a national training, anywhere from 2 to 6 people. Once again, at least one person from your organization and the team is required to have one community member. If you're interested, let's say, for example, we're working with an organization in Indianapolis and they would like for their entire staff to be trained. So that's also a possibility. So I would say for national training, 2 to 5, but we're also willing to train your entire organization and work around your schedule to make that happen. Okay, someone text me this question. How far along do I have to
What's the
be?
next upcoming training dates?
Our upcoming trainings that we have posted online, our next 2 are full. Our next training that's open and we're accepting applications is for August 15th in Miami, August 15th through the 19th. And we'll be running 2 groups, one in English and one in Spanish, Escalate in Espanol. So 2 opportunities to attend. I also had someone text me a question. They said, how far along do I have to be in my Stigma? How far along do I have to be implementing my Stigma reduction intervention to be eligible for a learning collaborative? So I think, Chandria, that one is for you.
Yeah, so I will say that we have organizations that are really at different levels. And so we also try to meet organizations where they are. So we at least hope that you have a team, that you have leadership buy-in at your organization, and that you all have been thinking about this, even in terms of maybe collecting some preliminary data. But for the organizations that are currently in our learning collaborative, each of them are at different stages. And so we really do help, meet you where you are and pair you with organizations who work in similar contexts, where you can also learn from each other. So really, definitely the closer you are to implementing and ready to implement and press go and just really need refinement, the more you'll be able to get from it. But we definitely meet organizations where they are.
Last question for the sake of time. Will Escalate be offered at USCHA?
I want to say tentatively yes. We have it in our plan, in our work plan for the next project year to bring a cohort of about 20 to 30 people. So we're likely to do a pre-conference training, meaning 2 to 3 days prior to USCHA, we will host an Escalate training. Still working through the logistics, but I would say probably by early July, expect to hear more about USCHA.
Alrighty, I think that's all of them, Terrell.
All right, thank you very much, everyone, for your time. Thank you for joining our webinar. As mentioned earlier, please be sure to check us out at targethiv.org/escalate for more upcoming information on training, technical assistance, and our learning collaboratives.
Bye-bye.
Thanks.
Bye.
Have a good
Thank
afternoon.
you. Bye.